Wellness for Life is brought to you by Purim Physical Therapy, Gothenburg Chiropractic Clinic, Mojave Ottawa Community Action Partnership, and CHI St. Joseph's Health Weight Management Center.
Hi, my name is Missy Lindo. I'm a physical therapist assistant and lifestyle counselor with the Weight Management Center at CHI St. Joseph's Health in Park Rapids. Welcome to Wellness for Life. Today, I wanted to take a few minutes to talk with you about obesity treatment options available here in Park Rapids. First of all, obesity is a disease. It comes to us with lots of social stigmas, lots of misconceptions, and just flat out untruths. So when our patients arrive to their appointments in Park Rapids, they often come to us very anxious, nervous, vulnerable. And one of the most important things that we can do is help put them at ease and kind of check aside assumptions and judgment. There are many factors that contribute to obesity. We need to be careful to realize that family history, genetics, health conditions such as diabetes, as well as the environments in which we live in, contribute to weight issues. When patients arrive for their first appointment at CHI St. Joseph's Health, the first thing that we do is make sure that we take a thorough history and evaluation of the patient. Our multidisciplinary team, made up of nutritionists, dietitians, exercise specialists, lifestyle counselors, nurses, specially trained to care for our population, as well as physician's assistant and medical doctors, help make these decisions. When we look at the whole patient, we know that it's very important that we don't just treat how many calories you take in, or that we don't just treat how much that you exercise. In general, when we look at weight loss, it's a fairly simple equation. What you eat, calories, versus what you're burning using exercise or just activities of daily living. Most patients either need to move more or eat less, and for a lot of our patients, it's both. Unfortunately, there's this huge area in the middle called behavior change, which is extremely difficult, and that's where the individualized approach needs to come in. What research tells us is that there is no magic. There is no foolproof diet or supplement that is going to work for every single patient, and so we tailor our approach just to you. Once our assessment is complete, we will sit and visit with patients about individual options. Those would include nutrition intervention, where you worked with a registered and licensed dietitian. In that category, we do individual nutrition counseling. We also have the opportunity to work with patients in a group setting to make sure that they don't feel alone and grow that social support. Physical activity interventions include programs like our MOVE program, which allows patients to come in and use our physical therapy and cardiac rehab gym under the direction of exercise physiologists to be challenged at their own individual level. This is something that's oftentimes really difficult. People feel a sense of judgment. Oftentimes, they're not really sure how they can exercise in a safe way. And our exercise physiologists are skilled in really challenging patients individually. We also do individual training sessions with patients, as well as wellness coaching. Behavioral therapy is another option that we really strongly encourage with our patient population. When we start looking at behavioral change, our mental health providers really truly are our resident experts. So we work closely with mental health providers, not just here in Park Rapids, but across our area to help service those patients who need to receive care closer to home. And we're not talking about just treatment for things like depression or anxiety, but for healthy coping mechanisms, assessment of eating disorders such as binge eating or compulsive overeating. We really try to work hard to make sure that we're approaching and dealing with the whole person. We also have the ability to, in our medical weight management model, to prescribe medication for treatment of obesity. When obesity was classified as a disease, it helped improve insurance coverage for treatment of obesity. So we work very closely with our physician's assistants to help coach and guide patients through that process, realizing that medication is another tool that we use in conjunction with nutrition, physical activity, and behavioral therapies. Bariatric surgery is another treatment option available at CHI St. Joseph's Health in Park Rapids. Dr. Daniel Smith has done over 4,000 cases in our critical access hospital with outcomes greater than the national average. So options include the gold standard Roux-en-Y gastric bypass, as well as laparoscopic sleeve gastrectomy, as well as our newest procedure, the duodenal switch. All three of these weight loss procedures help patients meet their goals to improve their health, to improve their quality of life, as well as their body weight and composition. We acknowledge that having a conversation about your weight may be difficult. Please don't hesitate to give our staff a call. We are here to answer the questions that you might have and help navigate you to the right program and provider to meet your individual needs so that you might be well for life.
Thank you for watching Wellness for Life.
Brought to you by Purim Physical Therapy, Gothenburg Chiropractic Clinic, Mojave Ottawa Community Action Partnership, and CHI St. Joseph's Health Weight Management Center.